National Kids and Vaccines Day. I'm Erica Ehm, and I will be your host for this evening. Together with some of Canada's most knowledgeable minds in health and science, we'll dive into answering your questions about viruses, variants, and vaccines, and how we keep our kids and loved ones safe as we continue to navigate, I wish it would stop, COVID-19. Before we begin, let's take a moment to put our feet on the ground and acknowledge the land that we're on. Although we're gathering online this evening, it's important to take a moment wherever you are in the country that we now know as Canada to acknowledge the original homelands of distinct living Indigenous cultures. I'm joining you from Toronto, a city named from Kenyanaka, a Mohawk word, Takaranto. I also want to give special recognition to the Haudenosaunee, the Wendat, the Anishinaabeg, and the Mississaugas of the Credit, who have been calling this land home far before my family immigrated here from Eastern Europe, as well as all the First Nations, Indigenous, and Métis peoples who continue to live here. If you would like to learn more about truth and reconciliation and the mission and steps that you can take as a settler on this land, we're putting a link into the chat for you right now. And because this is a night of learning, if you're interested in learning more about the land you call home, and if you'd like to get to know the cultures of Indigenous peoples in your community, you can also visit the website native-land.ca, which we'll also put in the chat. Okay, it's time for housekeeping. First of all, before I go any further, I really want to thank you for showing up here tonight to listen to the guests that we have today. And I know that there's probably some great stuff on Netflix that you decided to come here instead and be a part of. So thank you for that. Let me start off by explaining a few options available to you for tonight's discussion. First, you have the option to turn on closed captions with the button that's at the bottom of your screen. In terms of answering questions, over the last week, we've collected a number of questions in advance through social media, and we're going to start with those questions first. But then, and in the meantime, plus, if you have questions, I'd love for you to jump into the Q&A right here at the bottom of the screen and throw your questions in there. We will get to those questions. And in fact, our job here is to answer as many questions as we can. Hopefully we'll do them live with the panel, but if we can't, we have very special guests here joining us. Our friends from the Vaccine Hunters Canada are joining us tonight. They're going to help us moderate the chat, and they will be doing their best to answer as many questions as they can in writing. And that's all going to happen in the Q&A section. So once you ask your question, once they're answered, everybody will be able to see the answers as well. All of tonight's moderators are health and science experts, so you can be sure that all of the answers that you're going to be receiving are coming with the best available science from expert sources. Okay, speaking of expert sources, I mean, I feel like Mike Myers, like I am not worthy. Wait till I introduce you to the panelists here. Please join me in welcoming these very extremely accomplished panelists. I would almost call them intimidating. The first one is Dr. Katharine Smart. She's joining us from Whitehorse. She's a 20-year pediatrician who works primarily with children who have experienced trauma and adverse childhood events. Prior to moving to Canada's North, she was a pediatric emergency medicine physician at the Alberta's Children's Hospital in Calgary and the Royal Children's Hospital in Melbourne, Australia. And Dr. Smart currently serves as president of the Canadian Medical Association, plus she's a mom of two. So she's there in the trenches with all of us. Next, we're going to go to Halifax. And please say hello to Dr. Christine Chambers. Dr. Chambers is a clinical psychologist. She's a Tier 1 Canada Research Chair in Children's Pain and a professor of psychology and neuroscience and pediatrics at Dalhousie University. She's also the scientific director of the Canadian Institutes of Health Research Institute of Human Development, Child and Youth Health, and the scientific director of a national knowledge mobilization network called Solutions for Pain, whose mission is to improve children's pain management. Dr. Chambers has published over 185 articles in peer-reviewed scientific journals and was identified by the Women's Executive Network as one of Canada's top 100 most powerful women. And if that's not enough, she is also taking care of 4 very busy kids at home. Dr. Manish Sadarangani is director of the Vaccine Evaluation Center of the BC Children's Hospital Research Institute. He's an associate professor in the Division of Infectious Diseases in UBC's Department of Pediatrics. He has worked in pediatrics throughout the world, including in the sub-Saharan Africa, Asia, Australia, North America, and Europe. His research links clinical trials with basic microbiology, immunology, and epidemiology to address clinically relevant problems related to immunization and vaccine preventable diseases. And of course, he's also a dad to 3 kids, very busy. Dr. Nisha Thampi completed her medical training, pediatrics residency, and subspecialty training in infectious diseases at the University of Toronto and the Hospital for Sick Kids. She completed a clinical research fellowship with the Antimicrobial Stewardship Program at Mount Sinai Hospital and the University Health Network in Toronto. She joined the Division of Infectious Diseases at CHEO in 2013. Her academic interests are focused on the prevention of healthcare-associated infections and antimicrobial stewardship. It is a mouthful. She is a dynamo, and she's also a mom of 2 kids. So you have a taste of the expertise that we have with us today. So without any further ado, let's dive into some of the questions that we've received from Canadians across the country about kids and vaccines. Everybody ready on the panel? Okay, yes, good. Are you with me? The first question is for Dr. Thampi, and it's a big question. What are the possible risks or side effects from the kids' COVID vaccine? And how worried should parents be about them?
Great question. And it is a loaded question to start the evening with, but getting right into it, I've been following the rollout in the pediatric age groups to better understand the impact and to counsel families accordingly. But the rollout in 5 to 11-year-olds is also personal for me because my kids are in that age group. But so far, the experience has been really reassuring in terms of the vaccine safety in this age group and the older kids. It's important to know, that the public health and clinicians following kids are keeping a very, very close eye on the safety of these vaccines as they roll out. It's a robust system of monitoring in place to identify and investigate any reported adverse reactions. So what we've learned so far in the US in a review of safety events following 8 million doses of the pediatric vaccine in 5 to 11-year-olds, less than 0.1% of kids reported an adverse reaction following the vaccine. Public health and clinicians moved quickly to identify and review these cases and found that in the majority of cases, like more than 90% of the time, the events were mild. And the experience has been similar. I can speak to the Ontario data because I live here and I follow it closely. In a report 6 weeks after the rollout, with more than 500,000 vaccines given to 5 to 11-year-olds, a very, very small proportion went on to develop mild reactions after the vaccine and none required hospitalizations.
Okay, thanks for that. Our next question is for Dr. Sadarangani. What is the risk of myocarditis from vaccines versus getting myocarditis from the virus itself?
Thanks, Erica. That's a great question, and it's great to be on this panel this evening. So I think that the reason this whole question has come up is that we've seen in adolescents and in young adults a very small increase in the rate of myocarditis after vaccination. Most of these cases have been super mild. A few cases have required being in hospital, but they've mostly fully recovered. And so because of that, there's been concern about myocarditis in the 5 to 11-year-olds. And I think to sort of counter that a little bit when the vaccine was being rolled out. We knew that the dose was lower. And so the dose in the pediatric formulation in this age group is 1/3 of that dose that is given to adolescents and given to adults. And so we were hopeful that that wouldn't be the case. And that's actually exactly what we've seen. We've now had this vaccine given to millions of children across Canada and across the US in particular. And we've seen that, the myocarditis cases tended to occur in those older people after the second dose. And we've seen in the US, a lot of children have now received their 2 doses, and we have not seen myocarditis in this age group. In fact, the rates of adverse events that are being reported to Health Canada in this age group is lower than any other age group. So I'm very reassured that we're not seeing that signal. I think we've got incredible surveillance in place. We have identified extremely rare adverse events occurring throughout this vaccination campaign. And so I think at this point, if there was something there that was occurring with any sort of frequency, that we would have identified it by now. So I think we can safely say that the risk of myocarditis in this age group is very close to 0.
And I think that we also have to address the fact that it seems to be one of the side effects from getting the virus itself. So that a lot of people were worried about myocarditis from the vaccine, but in fact, the risk is actually great if your kids, or is the risk great if your kids contract COVID?
Absolutely. So, myocarditis, inflammation of the heart muscle, is something that we see as a rare complication in lots of viral infections. It's not just COVID, after influenza and other viral infections as well. And certainly we've seen, a proportion of people after COVID get myocarditis, and including adults as well as some of the older kids. And so absolutely the risk after vaccination is much, much lower, even in those adolescents and even in the adults. So overall, the risk benefit still favors getting vaccinated.
Okay, thank you. Dr. Smart, this one's for you. Talk to me about kids and long haul COVID. Can kids get it? Can they get long haul? Is it a concern of yours? Or is this overblown?
Yeah, great, important question. And I think important for people listening to understand, it's still something that we're learning about. So there's been lots of data, lots of different studies pouring in to help us understand this. It's obviously something that we're taking very seriously. And a few thoughts for folks. First of all, it's really common for children with any viral illness to sometimes have prolonged symptoms, by which I mean things like cough, runny nose, fatigue. We see that with many of the common viruses in children, and we are seeing that in COVID as well. I think the bigger concern people have had has been around some of the talk around cognitive changes or these really significant changes that last months and months. And that's certainly something that we've been monitoring. Some of the initial studies suggested that perhaps it was fairly common, like 8 or 10% of kids were maybe getting this. Some of the newer research that's been a little bit of higher quality, meaning we have control groups. We're following over months kids who have had COVID, and then an age-matched control of kids who didn't have COVID and monitoring their symptoms. And what we're finding with that type of a look, which is a little bit of a higher standard for data, long COVID actually seems a lot less common than we maybe thought initially. So maybe more in the range of 1 to 2%. So I think that's reassuring. However, that's obviously still something that worries us, because if you're in that 1 or 2%, then that's going to be potentially significant for you. So I think it's something that we're learning about. It's something that we're monitoring. There's evidence in adults that suggests vaccines, again, can maybe help prevent that complication. So I think it's just, again, another reason to choose to have your child vaccinated, is there's some potential protection against that as a longer term complication.
Okay, great. Thank you, Dr. Smart. Dr. Chambers, I have a question for you. This is more from a psychology point of view. This pandemic has forced us to have conversations with our kids that are pretty different from the ones that we're used to having. Tell us, how do parents prepare kids to get vaccinated?
Yeah, it's a great question, because in the middle of all of this stress and at times it feels very chaotic, parents can sometimes forget to have the simple conversations with their kids about why getting vaccinated is important. Obviously, it depends on the age of your child, how much you're going to share, but some of the general messaging that this is to keep you healthy and to keep those around you healthy. And also really making sure that you remember to tell your child you're taking them for a vaccination. Sometimes parents are so busy and book things, they forget to really tell the child. And Sometimes, I mean, no kid likes going for needles, and parents sometimes avoid telling their children. And so really having a calm and honest conversation, and then using some of the strategies that we know helps to make vaccinations more positive, or the experience more positive. So, planning to distract your child while they're getting their vaccination, teaching your child some basic relaxation, like taking a deep breath. There's even numbing creams that you can purchase at your local pharmacy over the counter that you can apply before you go, that helps to reduce the pain. So really the focus for parents is keeping the vaccination experience as positive as possible.
Great. Sounds good. The next question is coming to us on video from a couple of concerned parents, Artie and Marilyn. Let's watch it.
Hi, my name is Artie. And my name is Marilyn. We are the parents of a 4-year-old. Our question is related to our inability to vaccinate our kiddo against COVID-19. What is the difference between our kid now not being eligible versus in 8 months when they turn 5? Thank you.
Okay, let's turn this one over to Dr. Thampi to answer this question for Artie and Marilyn. What would you say to them?
So it comes down to dosing and what's been approved and what's been studied and approved as safe. Following the dose finding part of the trial for COVID vaccines in kids, a lower dose of 3 micrograms was chosen and is currently being studied as part of a 3-dose series for use in kids under 5. There probably isn't much of a difference from an immunological perspective, but the goal of a vaccine trial is to study safety first, followed by effectiveness. And, we currently do not have a vaccine approved yet for kids under 5. That's been studied and reviewed, peer reviewed. So I know I can appreciate how stressful it is for parents like Artie and Marilyn, whose kids are going to be 5 this year and are waiting for a vaccine to add to their kids' personal protection. And it's yet another reason why it's so important for anyone around kids, especially under 5, to be vaccinated if they can be.
Thank you for that. Let's move over to Dr. Sadarangani, and I'm going to ask you a question that is actually connected to that one, which is, when is it safe to give kids who were born in 2017 their first dose?
Yeah, thanks, Erica. So, I think it comes back to the similar issue and concept that Dr. Thampi was talking about. So I guess if a kid was born in January 2017, then they will have just turned 5 or maybe turning 5 in the next few days. And then they'll be eligible for having the vaccine. And as the year progresses, more and more kids will turn 5 and will be eligible. So that's with the current vaccines that we have available. Having said that, there are trials going on in younger kids all the way down to 6 months of age. And we're hopeful that some of those data will be available in the springtime. And then vaccines may be available in younger children, even down to 6 months of age in the spring or maybe in the early summer. And so then it will be possible for almost every child to be eligible for vaccination.
That's great. I find this so fascinating how there's a group of parents who under no circumstances will have their child vaccinated. And there's another group of people who are yelling and screaming, why can't I have my kid done now? So it's interesting how everybody is just looking out, to help their kids. What can they do? Dr. Smart, the next one is for you. And this one is coming to us from an 8-year-old Theodore who's on video. Let's take a look.
Hi, ScienceUpFirst. My name is Theodore. I'm 8 years old and I have a question for you. Why do we need 2 COVID vaccine shots?
Simple and to the point. Dr. Smart, what's the answer to Theodore's question?
Well, thank you, Theodore. I think you're asking the question all the kids are wondering about, like, why 2 shots, right? Don't we all wish it was 1 shot? So great question, and you're not alone. So the main reason for that, and this is how most vaccines work, is the vaccines are basically giving your body a blueprint of how to make antibodies to protect you from getting sick when viruses come near you or get into your body. And that first dose of the vaccine sort of primes your immune system. It's like the blueprint's in there and it's kind of saying, hey body, I'm here. And your immune system goes, okay. And it starts some sort of initial building of an immune response. But when we give that second dose, after your body has had a little bit of time to think about what it wants to do, it makes a much deeper response to that same blueprint, and the quality of the immune response and how long it lasts is improved significantly. So that's why we need 2 doses. And that's why with most vaccines, there's more than 1 dose. Some need to be boosted at different intervals, things like the flu shot we get every year because the virus changes a little bit. And it's all just about giving our body the tools it needs to give us the best immunity and protection from getting sick.
Okay, that's great. And I'm going to move over to Dr. Thampi. And here's a question that kind of builds on this. Looking at the cohort of Canadians between 12 and 18, many of whom have been eligible for their second dose for quite some time. Dr. Thampi, the question is, will there be boosters? So a third shot for kids aged 12 to 18.
I'm only smiling because I understand that NACI is reviewing this very question.
Yeah.
And, you know, I'll speak in principles, like the goal of vaccination, you know, like essentially it's to reduce the risk of severe disease, hospitalization, and death in every age group. And because of time, antibodies can decline, as all antibodies do, and the risk of breakthrough infection will increase over time. And so the goal of boosters is to increase those antibody levels, which appear to correlate with better protection from symptomatic disease. But other parts of the immune system and memory responses are really important too. And that's what Dr. Smart was getting at. You know, that second dose, what we've learned overall and in kids and teens, that second dose has offered a really good added protection, and kids and teen overall have a much lower risk of severe disease. So in the general population, and particularly otherwise healthy 12 to 18-year-olds, this is being discussed because a booster may have less of an impact at the individual level. But for some kids who are at a higher risk of severe disease and may need to have their antibodies boosted for additional protection, boosters may play an important role there. And they may also be helpful for kids older kids who work in higher risk settings with populations who are at increased risk of severe disease and complications from infection.
So what you're saying is it's in the works, and we're going to find out what NACI recommends. Do you have a timeline for that? Any word?
No, I'm hopeful with the rest of you that it'll be very soon. But I think, you know, what I wanted to take a step back and just show how it's being weighed, right? So it's not just about doing more, it's about the additional value at the individual level and at the population level. Recognizing just, you know, recognizing that it's a balance of risks and benefits to the individual teenager as well as to the population.
Well, we have a similar question for Dr. Sadarangani. It's coming to us on video from Mia, who's 7, and Bronwyn, who's 12. So let's have a look.
My name is Mia, and I'm 7 years old. And my name's Bronwyn, and I'm 12 years old. My question is, how long does protection for the COVID-19 vaccination last? And will my age group to 5 to 11 need a booster? Thank you.
So there's a great questions from very smart kids. And the question, while on the surface seems relatively straightforward, actually there's a lot underneath that. So I'll try and sort of talk through that and try and simplify it as much as I can. But Erica, feel free to ask for any clarifications, because I think what we really need to do when we're thinking about the effectiveness of these vaccines and the duration of these effectiveness is, what are we trying to prevent? And there's 2 things in which people commonly look at this: is preventing any disease, so anyone who gets COVID and any sort of symptoms, whether that's really mild to really severe, or preventing the severe end, so preventing people ending up in hospital. So there's 2 elements to that piece. And then also we've got to think about it in pre-Omicron and with Omicron, because again, that has changed the perspective of things actually very quickly, as we've seen over the last few months. So if we talk about pre-Omicron first, I think we've seen that with Canadian data and data from around the world, that after around 6 to 8 months of vaccination, you do start to see a drop in that effectiveness of vaccine against any disease. If you take them all comers to around, from the over 90% in the first couple of months down to maybe 60 to 70%. Having said that, against hospitalization, you're still up around 80 or 90% protection. So still the protection against hospitalization does last a bit longer than protection against all disease. With Omicron, those numbers are basically just lower. And so the protection against any infection goes down a bit quicker, and by 6 months is very, very low. There's still some protection against hospitalization, but it's more around 50% rather than up around 90%. What we have seen with the boosters is that you're able to boost all of this. And so now you're talking about, preventing hospitalization around 90%, whether it's Omicron or pre-Omicron. So really, really good effectiveness against the severe disease that we're really trying to prevent. Now, most of these data come from adults. There's a little bit of data starting to come from adolescents. I think, the challenge with all of these is that you have to wait this time, these months after the vaccine program and after vaccines have been given to enough people to know how good that protection is. But we've seen across multiple age groups very, very similar results coming out. So I think that, we can expect similar results to be seen in the adolescents and similar results, hopefully, to be also seen in those 5 to 11-year-olds. In terms of the boosters, yeah, sorry, Erica, you were going to say something.
Well, you're probably going to just finish it for me. So go ahead.
Well, I think in terms of the boosters, so right now, the 18 and above are being recommended to get a booster. The recommendation we've heard from Dr. Thampi, that's going to come for the 12 to 17-year-olds from NACI, and we're expecting that soon. And then the 5 to 11-year-olds will come a little bit beyond that. And I think what's really, really important for us is to make sure that we really focus on the data from Canada. We have taken a slightly different approach to a lot of other countries. We've had that longer interval between the first and second dose, which we know gives better protection over the longer term than the short interval that is being used in a number of countries. So I think we're in a really good position. We're starting from a good starting point. And then we will see over the next few months how long that protection lasts. We don't yet know if more variants are going to emerge and what they look like and how the vaccine will have an impact. And we don't know what overall the rates of circulation of the virus are going to be in our communities. And all of these will have to be taken into account when that decision is made around boosters.
Okay, so the answer is this is a work in progress.
That's a very good way of summarizing it. Yeah.
Okay, and by the way, we can't talk about new variants because we're just not going to have any. I'm planning that. Please, okay, guys? Dr. Chambers, speaking of pressure and stress, all of this information about doses and layers of protection, that's really great, but I know a lot of parents are having a hard time dealing with COVID-19, probably harder than their kids. And I'm talking about the anxiety and the stress. And there's been some talk that some of the anxiety that kids are experiencing have been inadvertently passed on by us, by worried parents. So how can parents cope with the stress and anxiety so we don't pass it on to our kids?
Yeah, it's tough. I mean, this is a stressful time. It was hard enough being a parent before the pandemic. Layer on a pandemic, all the changing information, the tough decisions, the constant monitoring. So it's no wonder that parents are tired and stressed. I think it's really important for parents to remember, though, that they do set the tone. And so, we talk with parents about making sure that you're taking care of yourself, that you are putting your own physical and mental health first, that you are knowing your own limits so that you can be the best parent for your child. In terms of managing anxiety in general, we know that, being calm, being honest, being caring, that these are all important messages to be sending to our children. One of the things we forget about anxiety is that when we avoid things that make us anxious, it actually makes the anxiety worse. And so that avoidance really fuels anxiety. And so certainly with kids and parents through this pandemic, we've had to avoid a lot. There's been things we've been told to avoid, but there are times where we do need to sort of face our fears, whether that's, going back to school, and really emphasizing the importance of routines for kids and for parents, being flexible, and also emphasizing the safety measures that we can all, participate in, the masking, the distancing, while we're trying to maintain our routines and a bit of a positive attitude.
Okay, I have you on the hot seat, so I'm going to ask you something else. We know that getting our kids vaccinated is a good thing, but the reality is that there's still a chance that they'll get COVID-19, even when they're fully vaccinated, even when we're doing our best as parents, and even as our kids are doing their best. So how do we prepare our kids for this so that if they do get COVID, that they don't feel like that they're not terrified, because we've been telling them all this time to, to be careful not to get it, and also to let them know that it's not their fault, so they don't feel guilty or they've done something wrong.
Yeah, I think this is such an important point, especially now as we're in the middle of this Omicron wave, where it's much more likely that kids will get COVID, even if they've done everything right. And I know in our house, we've had conversations in advance to prepare kids. You might get COVID and it'll be okay, and explaining why it's different now because of the vaccinations, because of all that we know, and it's a different scenario than, say, the beginning of the pandemic where, their schools were closed and it wasn't, was deemed that they had to stay home. So I think really just acknowledging that possibility, really destigmatizing that for kids and families. And now most families know somebody, who has had COVID. And so, in our household, really talking about, most of the time it is not going to result, in children being in hospital, and that really trying to kind of give some examples and give some models and just really normalizing it as much as we can, realizing this doesn't feel normal at all.
Yeah, exactly. Dr. Thampi, this question is a big one. It seems to be a common concern among vaccine hesitant parents. So we need a good answer for this. Will vaccines affect puberty in children? And I want to just add here that some of the common concerns being asked around this is future fertility in all genders.
As a parent of kids who are 5 to 11, I totally get the weight of making a decision that may impact future outcomes in our kids at this age. I have to say, in this case, there is no evidence that any vaccines, including COVID-19 vaccines, have an impact on puberty in children. This has been seen in follow-up data among kids and teens who have received vaccines. And we have had zero signal in the short time that we've had the vaccine on the market that kids are being impacted in terms of their puberty, in terms of menstrual cycles, or the onset of having in terms of starting their periods. I will say that there have been reports of early onset, or what we call precocious puberty, following the initial lockdown in the spring of 2020. And I'm mentioning this because, it doesn't take much to Google puberty and COVID. And, the point is the signal was well before the availability of vaccines. And that's been the only signal that we've seen around puberty and COVID-19, and it's actually related to the lockdown, likely. So it's interesting, and it may speak to environmental triggers of puberty and certainly warrants further study, but it's not been seen following vaccination. And this, I'll say that this was not a concern that I had, but I can appreciate when we're having conversations about a new kind of vaccine, or what seems new in the public space, but is actually founded on years and decades of research in the preclinical space, that this can be a concern, but not seeing an impact on puberty. Dr. Sadarangani kind of came at it before when he said it'll take us years to be able to answer that, to truly answer that question with the data that we have. But again, no, we've never seen this as a consequence of vaccination. And really, vaccines, the goal for them is to get the immune system ready to see the real deal. And I'm far more concerned about the unknowns related to this new virus than the vaccine principles that, you know, than the immunological principles that follow getting a vaccine.
Right. Okay, great. Thank you for that. Dr. Sadarangani, another common question we've received is about pre-existing concerns like allergies. For example, my daughter has allergies. What if my kid has a lot of allergies? What can you tell us about allergies and vaccines, and if one affects the other?
Yeah, so this has been, a lot of questions have come up about this. As, most people remember when the mRNA vaccines were first being used in adults, there was a lot of reports of allergies. There was a lot of attention around polyethylene glycol in particular, which is one of the ingredients in some of the vaccines, and is used in a lot of other things. So a lot of people have potentially been exposed to it in a lot of other medical therapies. And actually what we've seen over time is that essentially the bottom line is that for people who have allergies, even if they have lots and lots of different allergies, food allergies, environmental allergies, that's not going to have any impact on how they respond to the vaccine. And actually, what we've seen in our vaccine allergy clinic here is that even in people who have a genuine reaction to polyethylene glycol, have been able to have the vaccine completely safely. And in all the kids that we've looked at, none of them have had any reactions actually to the vaccine itself. Okay. And so I think that there's clearly some. If you have a child who has a true allergy to one of the ingredients of the vaccine itself, then I think that's a reason to seek medical attention before vaccination and get a consultation from your local team and take the advice that they give you. But in general, we're not seeing this as a major issue in children.
So does that mean that the ingredients are readily available for families whose kids have allergies? They can call up their doctor and say, I need to understand what the ingredients are so that they know which ingredients they may be allergic to. Is that how it works?
Yeah, absolutely. And in fact, they don't even need to call up their family doctor. If you just sort of Google search the Health Canada drug product database and just type in the name of the vaccine, and then it'll take you a link to the vaccine product monograph, and that will have a list of every single ingredient that's in these vaccines. And so people can just look it up themselves. And it will highlight the things that may be potentially allergenic as well. So it's very easy and available for anyone to do for themselves.
Okay, what I just love about that is just the transparency in general. If you know what I mean, because a lot of people are saying, well, what's in it? I didn't even know that you can look it up. So that's great. Dr. Smart, a question from parents and guardians with really little ones. Can you tell us, when will toddlers be able to get vaccinated?
Yeah, I know there's lots of parents really wondering about that. Of course.
Daycare, right? They're all at daycare.
Yeah, totally. And it's stressful right now, I think, with Omicron spreading really quickly, and parents that are keen to get their children vaccinated really want that vaccine. So, where we are right now is trials are ongoing in that age group. So we haven't seen an approval yet, but we think we're getting close. So what we're hearing, and again, I don't know this for sure, but is something likely will be coming out in the next couple of months. So I think we're optimistic as we head into spring. We'll hopefully have a vaccine dosage that's been approved for those younger kiddos. And then those parents of kids that age can feel confident that they have the option of vaccination as well. So I think it's like right around the corner, coming soon.
Okay, cool. And another quick question. Can kids get both the COVID shot and the flu shot at the same time?
So so let me explain that a bit. So yes, you absolutely can. It's very safe to have your COVID and flu shot at the same time. NACI initially had recommended a 2-week spread between the two vaccines, and not because of safety, but rather because of what you were hearing earlier, because this was a newer vaccine rollout and we're doing really close safety monitoring and looking for any unusual side effects or things that we didn't expect. When you do two things at the same time and something happens, it's hard to know which caused it. So they felt it was prudent, or just a bit more cautious, to say, let's spread the two vaccines out a bit. Then if something happens, it'll be more clear. But I think now that we know a lot more about it, we're really not seeing adverse events. If you want to get your child vaccinated at the same time for flu and COVID, totally safe to do so.
You're free to go. Okay, great. Thank you for that. Dr. Chambers, let's talk what you love to talk about, which is needle fear. Before I ask the question, I really want to I want to shout out to all the parents and guardians out there who are managing their children's needle phobias and their own, because this is a very real fear. And it really requires a lot of empathy on the part of the family, on the part of health practitioners. It's a big deal for people to get vaccinated in a lot of cases. So here's the question. My daughter is scared of needles. What are some things that I can do to help her get over her fear and get her vaccinated? Dr. Chambers, over to you.
Yeah, so needle fears, needle phobias are unbelievably common. We don't talk about this problem enough. And, you know, this is a really important time to be talking about it. And the fact that kids have to go for 2 doses means that we really need to address this, because if they have a negative experience the first time, it becomes that much harder for parents to get them back the second time. So of course, for all children, especially children who are anxious, we want to do the best that we can to make the experience positive, as I mentioned before. So preparing kids, doing everything you can to manage pain, giving kids something to look forward to after the needle. People often ask me what I think about bribes, and I'm like, that is total positive reinforcement. Absolutely, go for it. But there are a group of kids who develop, and it's not just kids, it's adults too, who develop almost like a phobic reaction to needles. And once that fear, that phobia is in place, it can be really hard to manage without specialized treatment. At the very least, you want to let people know in advance. And I know some of the vaccine booking tools have a place where you can actually say, you know, I'm going to need some more support, or my child's going to need some more support. There have been some vaccine clinics that have been advertised for kids who are anxious, or for adults who have anxiety, so specialized treatment. Certainly children with developmental disabilities, sometimes they require special support. But if you have a full-blown phobia, psychologists, registered psychologists can treat phobias in just a few hours or sessions using something called exposure therapy, where you're taught coping skills and then you're gradually supported in fear, in sort of facing the feared stimulus, in this case, a needle. So I think my message is to say it's very common, it's very normal. There's some steps you can take to prevent and deal with it in the moment. But if you have a full-blown fear, there are specialized supports through psychologists to help address that phobia.
Thanks, that's great. Okay, moving along now, we have a question for Dr. Sadarangani. How long should we wait to give our kids a vaccine post a COVID infection?
This is another really, really good question. And I believe, you know, just first thing is that I think NACI is going to make a formal statement on this fairly soon as well. I think that, you know, there's a few things to sort of consider. So I think one, an infection will provide people with a degree of protection in the short term. That's different for different people. In general, milder infections tend to give less of an immune response. And so that protection may not be as long as it is for someone with a severe infection. But for any individual person, it's really hard to know for sure. So in the short term, there's probably some protection. From a safety point of view, there's no problem and no concerns about going and getting your next dose of your COVID vaccine once you're recovered from the COVID infection, once you're not needing to be isolated anymore. And in general, public health clinics and other vaccine providers are offering, you know, as soon as you're well enough, come to the clinic and we'll give you your vaccine. And we know that that vaccine will produce a good immune response and will provide protection. There's some theoretical evidence to suggest that if you waited 7 to 8 weeks, so similarly to how we're waiting between the doses of vaccine, sort of 8 weeks or so, if you wait 7 to 8 weeks, then there may be a slightly better immune response, which may be slightly better protection. But I think we're really talking about a small difference. I think getting it soon would be very good. Getting it after 7 to 8 weeks may be a little bit better. And I think what my message would be to most people is, don't use the fact that you've just had a COVID infection or your child just had a COVID infection to be the main driver of when you go and get that next dose. And that is going to be different for different people, right? So if you're going to go off on a big trip somewhere, you know, for several weeks or several months, and this is your chance to get vaccinated, it's totally safe and it's very effective to do so. If you have close contacts who are immune compromised or some other reason that you might want to get that next dose of vaccine sooner, that's totally fine. If someone's, you know, wants to wait or is happy to wait, that's also okay. So if for a short period of time. So I think it really is something that, you know, people should decide when they're due to get vaccinated. They can go and get vaccinated, and don't use that COVID infection as a reason to necessarily change your decision.
Okay, great. So that's really a sort of a stress-free answer in a way, is that you get to choose. It's when you're going to get dosed again. Dr. Chambers.
Just go get it.
Just go get it. Dr. Chambers, what would you recommend to parents who do not agree on vaccination? When one parent wants to vaccinate and the other doesn't, what do you suggest?
Yeah, that's really a tough situation. And you know, opinions can be so strong here. And this is where I think it's really important to rely on healthcare providers as allies. And so really encouraging both parents to go and speak with the healthcare provider, get the information in a balanced way, and hopefully be able to reach a consensus on that. It's really difficult. And so that's when listening to healthcare providers and getting that expertise can really help parents navigate some of those challenging conversations.
Here's an interesting question for Dr. Thampi. Given the risk in contracting Omicron, why can't parents pursue off-label vaccination for kids under 5?
I feel like that's a similar question to what was asked before, and in terms of being able to offer the vaccine, like what's the difference if it's not substantially different from an immunological perspective, then why not? And I think it again goes back to what's been studied and what's currently under study, right? So there was a dose finding portion of the trial for kids, and there was a decision made by the company, and I can't speak to the data because they haven't released the data for families and for clinicians to inform families about the risks and the benefits of having a higher dose for that younger age group than what is currently under study. And so I think that's where I've landed in terms of the response that I've given to families. Like, right, I can appreciate the concern around Omicron and kids. I have to also say that Omicron in and of itself does not seem to be more serious in children. We are seeing more hospitalizations during this wave that seem to reflect the intense spread in the community. The vast majority of kids are not developing COVID pneumonia or needing the ICU like we're seeing among adults. It doesn't mean that I'm encouraging I'm not encouraging people to get infected with Omicron at any age, but that's where I go back to the primary prevention efforts in individuals who are around those children who are not vaccine eligible. So far our experience has been that we've seen much younger kids than the 3 to 5 year olds who are needing hospitalizations. They are brief, but in my mind, contributing to that circle of protection around the kids who are not vaccine eligible is the priority. And then I hope that we will be able to review the data for the kids under 5 in terms of in terms of the 3 microgram and the 10 microgram dose, so we can better understand the risks and benefits, and then have that conversation with families so that they can provide informed consent. Right now, I'm not able to inform them of the risks related to what has been studied and what's currently under study.
I feel like in this whole conversation and all the answers that I'm getting from each of you tonight, there's no guessing here. It's all based on data that has come out. And you don't deviate from that until you're told that the research has been done and these are the results. And I really respect that. So you're not making sort of these educated guesses anymore. It's like you want to hear what all the data is telling you. Dr. Smart, some parents are doing a wait and see approach because they're waiting for more robust data about the vaccines. Is there any urgency to vaccinate kids 5 to 11?
Great question. And I think what's in that question is sort of what we knew when this vaccine was going to be approved. We were hearing from that group of parents that weren't quite sure that was really their main reason they weren't quite yet sure. They were like, we just want to see what happens in the real world. We want more information, more experience with the vaccine before we make a decision. I think what's really different about where we find ourselves today versus 2 months ago is we do have all this experience you've been hearing about tonight, over 8 million doses given out now to children in North America. So that's, the studies looked like everything was safe when we were confident in the vaccine, but now we can just be that much more confident because we have that much more information. And like you've been hearing, very few adverse events, very similar to other adverse events from common vaccines, sore arm, bit of fever, maybe you're tired for a day. That's mostly what we're seeing. We're seeing excellent protection against complications from COVID with the vaccine. We're also seeing the added protection against some of those post-COVID complications, like you've maybe heard of multi-system inflammatory condition. The vaccine makes that 90% less likely. Even long COVID, it looks like perhaps there's some protection from the vaccine that we're still learning. So I think everything that we're finding out about the vaccine is just telling us it's safe and it's effective. And then you combine that with the fact now we have Omicron, which is spreading rapidly, which means, over the next few weeks and months, most of us are going to get some experience with COVID, whether it's through being immunized or having contracted the virus itself. And now we have a really safe option to take what is already a low risk of something bad happening with our children to an extremely low risk. And I think that's what's a bit tricky for parents, right? We're saying, most kids do okay that get COVID, and that's true, but not all. Some do end up in hospital, some do end up really sick, and we just don't always know who those kids are going to be. And now we have this really great safe option for kids 5 and up to make the chances of that minuscule. And that's why I think, choosing to get vaccinated now makes sense. It's safe, it's effective, COVID's not going anywhere. Let's get our kids protected and let's prevent those rare things from happening.
Thanks, Dr. Smart. I'm going to take this one step further with the next question to Dr. Sadarangani. What are the long-term effects of these vaccines? We don't have a long-term study. How can we know they are safe?
So that's another good question. I think, thinking back to all of the vaccines that we have, and even the mRNA vaccines, that the platform has been around for a long time, and we've been using them in clinical studies for several years. So as most people will know, most of the side effects that you get from a vaccine happen within the first few hours, the first 2 or 3 days, and resolve very quickly within a few days. And the sore arm, the pain, the swelling, fever, headache, fatigue, all those sorts of things that we've been discussing. So they tend to be over a few days. There are some very, very rare side effects that happen, when you trigger the immune system, very occasionally, very rarely, that you can get these immune-mediated things that can happen after vaccination. But even then, they tend to occur either within a few days or within a few weeks. And if you look at the way vaccine safety is reported in Canada and also across the world, they tend to look at a window period up to around 6 weeks after vaccination. If something happens in that 6-week period, depending on what it is and depending on the rest of the story and the medical history, it may be something that's related to the vaccine. Beyond that, we don't really see vaccine-related side effects happening in the longer term. And for a lot of the things that have been mentioned in, not necessarily just tonight, but just in general around effects on fertility and things, it's really hard to think of a sort of biological mechanism by which that could occur. And when we're talking about these kids who are getting mRNA vaccines, that mRNA degrades relatively quickly after it's been administered. So it's not hanging around for a long time to cause that impact. And so I think that while yes, the first people who were vaccinated in Canada with these vaccines outside of the trials were just over a year ago. And so that's the accumulated safety data we have. We don't have 5-10 years worth of long-term safety data, but we never have that when we have a new vaccine. Yes, everything went very quickly, but we don't usually wait for several years after a vaccine has had a research study to see what those effects are before we implement it. And I think, you're really balancing up the real risks of COVID infection that we've been discussing, not only acutely, but also these rare syndromes like the MIS-C that Dr. Smart just mentioned, against things that are some theoretically possible, some that are even theoretically very hard to imagine how they would occur. And I think we need to deal with what's in front of us. We need to deal with the real risks that we're seeing in front of us. And then as I mentioned earlier, I'm very reassured by the safety surveillance systems we have in place, not only in Canada, but elsewhere. We've been able to detect these extremely rare side effects in these vaccine programs. And so I think if there is something there, we will detect it.
Okay, that's very reassuring for me, at least. Dr. Thampi, how much protection does the vaccine provide? We hear about the percentage for adult protection, but do you know the rate for kids?
So that's, I think that's actively being reviewed. So the rate, as you've pointed out, we've just seen data about the effectiveness of the vaccine in adults who, like, during this wave is what I'm thinking about, because we've had, now a year of data around the effectiveness of the vaccine. But in kids, with the previous variants, the vaccines were effective. We would see hospitalization, so the risk of being hospitalized if you had not been vaccinated was or the odds of being hospitalized were about 14 times greater if you were not vaccinated than if you were vaccinated. And that was adolescent data. In children at that time, they weren't eligible for vaccines. But what was interesting, and again, it brings me back to the public health measures and what we can do around children, in those states, because this was an American study, in those states that had low vaccine uptake among adults, the rate of hospitalization in kids were multifold higher than in states where there was high uptake among adults, speaking to the public benefit of vaccination in reducing the risk of infection and transmission to others. I think this is actively being studied in different parts of Canada in terms of the effectiveness of the vaccine for younger kids. But again, in terms of the previous variants, there was just a study that came out in the New England Journal of Medicine about the effectiveness of vaccines in teenagers. And it was very high against hospitalization. It was very high. And this has also been shown in France. This was, an American population, but it's also been shown in France that it's highly protective against MIS-C, that inflammation and the heart related inflammation that can follow MIS-C. So a lot of those complications were far, far, far less. And in fact, so all to say the vaccine was highly protective in those kids in that age group. So I don't expect to see anything different in terms of children. And I can say, like I said, it's actively being studied now, but at least our experience among the pediatric hospitals in Ontario is that that we're seeing a higher proportion of kids who are not vaccinated, whether it's because they were vaccine ineligible or they were eligible but not vaccinated, coming in with brief stay, but again, sick enough to require admission. But, and again, it gets back to how they're being exposed to the infection and the protective measures that can help to prevent them from getting exposed in the first place.
Thank you so much, Dr. Thampi. And thank you to everyone who has submitted questions tonight. We're going to stop right here answering questions. I really want to thank the experts, all of you who are, not with your family right now, who are taking time once again to answer these questions. But before I close, I want to ask you all one last question. It doesn't entirely have to do with kids and vaccines, but I'm hopeful that by sharing your experience, you might ease the hearts and minds of people joining us or people who are watching the recording. As scientists and healthcare professionals who are also living through this uncertain and difficult time, what is one of your pandemic coping strategies that you think families can implement into their lives to help them feel a little better or to ease this experience? Because we're all human here. Dr. Smart, let's start with you.
Okay, I'm going to make a confession. Every week I buy a box of donuts for my family from the local donut chefs here in Whitehorse. We have two excellent local companies. So we get the donuts, we cut them all up in pieces, share the flavors around and watch a show together. And that's just one of the things my family likes to do to relax.
Man, I eat the whole box myself. Dr. Sadarangani, what is your tactic for
So
surviving?
one of the things we've done is we've taken, the money we've saved from not being able to do anything and go out anywhere, and gone into the game stores and bought those really expensive family games that we never normally buy because they look way too expensive. And why would you spend that much on a game? And playing lots of games with the rest of the family. And I think it's just a really nice way for everyone to have some time together. But it sounds like we need some donuts to have alongside that as well.
Dr. Chambers, is it donuts for you?
No, I'd say this week my family is distracting itself playing Wordle and getting into a big family competition about Wordle. So, it's the small things, the small daily things.
Yeah. And Dr. Thampi, what do you do to survive?
There are the small daily things that we do to stay connected, like having, I'll say, unadulterated, meaning like no adults can distract me from having the visual FaceTime with my kids. The other thing that they love doing is taking my phone and losing it for me, and I get them to do that because it is like I find that the connectivity has been really important for my work, and it's been important for being aware of the information and being able to distill that to my workplace, to my patients, and to colleagues and friends who have been worried about kids and themselves throughout the pandemic. But by taking away that need to be present for others, I find that I'm able to make that space and be more present for my family. So I just ask them to let someone else know where they've put the phone so that I can find it, a few hours later, but that has been really therapeutic for all of us.
Awesome. So great. Thank you guys. Thank you so much, everyone, for your time and for sharing your expertise and your insights with us tonight. This is an intense evening because, we're getting a lot of information. We have to process it. But on behalf of the team at ScienceUpFirst, I hope everybody who has joined us tonight feels a little better informed and definitely inspired to help move the needle, pun intended, to protect our kids and our communities and ourselves. Now, here's the thing. I have an ask of all of you who joined us here tonight. I would love if you can take a minute to share some feedback with us, because at the end of this town hall, you're going to be prompted to respond to a very brief post-event survey. And we are giving away a special giveaway to the first 5 people who complete it. And if you don't even care about the prizing, do it because it's really helpful if you can fill out the survey so that we can plan events like this for you and share content that actually matters to you. So now, please join me in welcoming Dr. Marian Mader, Executive Director for the Canadian Association of Science Centers, who's going to close out this evening.
Thank you, Erica. And let me begin by thanking you for the wonderful job you've done moderating this evening. To our panel of incredible experts, thank you so much for your time and for the amazing work that you do day in and day out. You've provided many families great comfort here tonight, including myself. This can be a very challenging conversation to have. Your professionalism matched with your kindness is a gift, and we're so fortunate to have received it this evening. Thank you to our friends at Vaccine Hunters who fielded questions for our audience all night. You provided some much needed reassurance for those with questions. Here at the Canadian Association of Science Centers, our vision is for Canada to have a thriving science culture of engaged citizens. And we do this by making science approachable, relevant, and accessible. Our amazing ScienceUpFirst team is a shining example of this work. You all rock. Your dedication to fighting misinformation on all fronts is truly inspiring. Thank you for being the very best team. And last but certainly not least, I want to thank Big Bang Beige for producing this evening's event. Your work behind the scenes made it easy for us all to enjoy. And if you're still out there, thank you for joining us. We know that the year isn't starting off quite as we all had hoped. And still, we continue to persevere and support one another as best we can. ScienceUpFirst will continue to support you by sharing the best available science in creative ways so that Canadians from coast to coast can continue to make informed decisions for your health and safety. And for our French-Canadian friends and followers, we'll be hosting a live event en français on February 23rd at 12 noon Eastern Time. Please visit our website for more information. And if you're not already, I hope you'll follow us on all social media channels at ScienceUpFirst and visit our website to subscribe to our monthly newsletter. Thank you again, everyone. Be safe